Hi, I'm Julie Cini. I'm the CEO of Advocacy Beyond Borders, and a global organisation supporting patient organisation groups all over the world. Yeah, we did a number of different things to engage patients through the process of not only treatments but newborn screening. So with treatments, we surveyed our families. We did a lot of talking to our what's called our Pharmaceutical Benefits Advisory Committee, or PBAC, who are the payers. And of course, when you talk to the payers, they need to know certain information. And it was a really agile process. We are very lucky as a patient organisation that we don't need ethics approval because we don't have a hospital to report to. So we were able to get information on the fly. So the lady from the PBAC would say to me, "Oh, Jewel, we need X, Y, and Z information." And I would quickly go out and do a survey, usually from our Google Docs, just really simple, nothing that cost us any money, because we didn't have money to float around on, big surveys. And we would get this information, we would collate it, we would present it back to, the committee, and we would work with them constantly to provide them the things that they needed to know. In everything that you do, real world evidence is really important. I mean, I have lived SMA, or I don't live it myself, but my children lived it, and I knew intimately about the disease and what it did. And these living people are exactly like that. They are the people that we need to talk to, because they tell me that I need a carer 10 hours a day, I can't go to the toilet, I can't brush my hair. They give us what's actually happening in their everyday living, but they also give us expectations of what they think may happen when they receive a treatment. So, I want to be able to brush my hair again. I want to be able to cut my food and eat a meal by myself independently. I want to be able to go out and catch the bus to go shopping. They're all different things that we take for granted as an everyday living skill, yet they can't do it. So we need to find this information out. And if we don't find this information out and we don't present that to the government, then how can they pass a drug that's going to help them if they don't know how it's going to help them? So there were lots of toing and froing with surveys, and we did lots of stories in the paper or radio interviews. We did TV interviews. There were lots of just awareness. That was another great thing to be able to have in this campaign. If you don't put your hand up, you can't be heard. If you sit there and say nothing, nobody knows who you are. And you have to, in this process, amplify your voice. So amplifying your voice through, a media article, whether that be print, radio or TV, is so important. Someone gets to see that picture, someone gets to view on a camera or on a video in 3D, a kid that can't play with a ball or can't do whatever. It's super important to visually see that. We can read a story in a paper and we can be moved, but when you actually physically see it, your opinion changes. So to get people in those three sort of media types is also really important for the campaign, and that really helped us amplify our voice to make sure we were definitely heard. And celebrations were fantastic when and euphoria when we get to say we've passed this drug, or we've got newborn screening across the line. It's a fantastic, way to celebrate, that's for sure. Yeah, as a leader of a patient organisation, my view on the whole thing was I needed to look after the whole community, and I would urge anyone globally listening to this is to think on the same level. I totally understand why people crowdfund, but it's not helping the whole community. We need to look at this as a team. We need to come together and be a team and play as a team, because as a team when one person wins, when the team wins, the whole team wins and everyone gets it. If we play individually, who gets it? The only person playing individually gets access. So as much as I understand why they're doing it, in my book, why is one person more important than the rest? So the rest also need to be looked after, and we need to come together and look at funding logically and how we get it, who we get it from, where we get it from, so that not one person is looked after, the whole team is looked after. Because there's many kids out there who need access, just like the person who got access to funding, and I want them to know that they're important as well. So we need to come back and we need to talk to big companies if that's how we're getting funding. I mean, a lot of these big companies sometimes have a benevolent fund or a community fund. Who do we need to talk to? Do we talk to the pharmaceutical company and do we say, okay, can we have a collective bargaining agreement? And if there isn't medicine available in your country, can we pay for it at a lower cost or through a fund or whatever it is? We need to open those lines of communication where we understand that if there is a co-payment, what does that co-payment look like? And can farmers sustain doing this on a global scale? So I think that's going to be, for me, a really important conversation to have moving forward, so that no one is left behind. Like I said before, you don't ever want to see your kid die, and we all have an opportunity and a part to play in making sure that no one is left behind. And for the sake of, I get it, it's dollars, but there's other ways to get dollars. One covers something somewhere else. We need to come up with a logical plan of attack where if this mechanism happens in this country, they're okay, but it's being paid for full of cost over in this country, and it might, chop and change. So hopefully moving forward, we can have those important conversations so that we don't leave anyone behind. I understand crowdfunding, but I get really sort of not annoyed, but frustrated how one person is chosen over everyone else. And I think everyone else needs to be chosen as well. That's my feeling on that. Good luck. It's a long, hard road. It's rewarding, don't get me wrong. It is so rewarding. I have had some of my best life moments, in advocacy. You have to bite off small pieces. Don't do everything all at once. Do one thing at a time. Get low-hanging fruit first. If that's resources, build your resources. If communicate with and collaborate with as many people as you can. Do not do this alone. You will die a small death really quickly and your association won't have any longevity. You need to be talking to people. You need to be asking questions. Constantly ask, what's being done, X, Y, and Z. Is there a minimum standard over the world? What do we need to be doing in our country to make sure that we're all on a level playing field? And it's not going to be it's not an easy fix. There'll be many conversations that you'll have, some good, some bad, some ugly, that you just want to walk away from. But don't walk away from it, because you've got that golden pile of gold at the end that when you get there, the most amazing feeling comes across your face and through your body that you'll never ever experience again unless you keep doing it. So it took me near 18 years to get that feeling. Hopefully now, because I've been through those long, hard roads, that the information that I can give won't take other associations or new organisations as long. But don't give up. The end or the power to have the end for these people and the solution for these people is near. You've got the power to change, to make a legacy for people in your own country, and I urge everyone listening to this to get out there and do it, because the reward is just amazing.